Hello, you guys. This is our presentation of the uses of lasers in the dental industry by me, Alex Jimenez.
Oscar Juarez.
And Yun back.
And the reason why we're doing this presentation is because dental services have been significantly impacted by the rise of the COVID-19 pandemic. The usual treatment with handpieces and ultrasonic scalers produces many aerosols that can carry a high risk of infection for the clinician and the patient. And since COVID-19 travels through aerosols, dental hygienists and other dental practices have to be forced to use an alternative method such as lasers.
Today, we're going to be talking about lasers. Lasers are light amplification stimulated emission of radiation. Lasers were introduced in the 1960s. They created an article of dentistry uses in lasers in 1985. There's three different types of lasers. There's continuous lasers, which produce a continuous ultra beam of light. There's pulse lasers, which are defined as lasers that produce pulse of 0.5 to 500 nanoseconds, and ultra fast lasers, which are lasers that produce pulse in the range of 5 to 10. And then these are some procedures that you can use with lasers, and every laser has their own procedure to be done with. So lasers in the pediatric settings, a benefit is that you don't need local anesthetics. It reduces the operator chair time and creates a less stressful environment without creating the noise and vibration of a handpiece.
With many great benefits of the lasers, there are many adverse reactions too. Some of them, it could be effects on dental pulp. The increase in temperature with the lasers can cause irreversible pulpitis and pulpal necrosis. There's also effects on the tooth surface. When you use a laser with water, there will be no visible cracks on the tooth, but there will be a 20% reduction in the bending strength of the dentin. But when you use a laser without water, that's when the severe cracks come into play and there's more damage done to the dentin. There's also some subcutaneous and submucosal effects of the lasers. Inappropriate use of the lasers with air cooling spray might result in claviculofacial, subcutaneous, and mediastinal emphysema. On to chronic periodontitis, which is the main thing that dental hygienists have to deal with. The definition is chronic inflammatory process whereby microbial deposits associated with the gingival tissues produce toxins that evoke tissue reaction, loss of bone, and gingival support. If untreated, it can lead to tooth mobility, migration, and tooth loss. On the interaction with the tooth surface, the laser light can be refracted, scattered, absorbed, or transmitted. As a diode laser light is highly absorbed in hemoglobin of blood, it becomes an excellent choice for the removal of highly vascular inflamed tissues of the periodontal pocket. Diode laser has thermal and photo-disruptive effects, which result in the elimination of periodontal pathogenic microflora in the red bacteria complex, which is the bacteria that causes the most damage to the periodontium. The benefits and results of laser therapy in chronic periodontitis: it causes hemostasis during the surgical procedure, sterilization of the wound site, reduced cellular destruction, and less swelling of the tissues, increased visualization of surgical sites, and decrease of post-operative pain. Use of laser plus SRP are beneficial in terms of the pocket reduction, reduce the BOP, improvement of CAL, and significant reduction in bacterial counts, which is the main reason for periodontal decrease progression. You can see in the picture right here, from left to right, there's been a significant increase in periodontal health.
Next is periimplantitis. A higher implant failure rate and elevated number of sites with periimplantitis bone loss was found. Patient who did not adhere to comprehensive supportive periodontal therapy. The DO laser is not a blended instrument, and it can directly contact the implant surface without inducing melting, cracking, or crater formations. And also, it does not damage the titanium surface. And the DO laser has many bactericidal effects, and the laser may facilitate detoxification of the implant surface. Therefore, the traditional protocols of non-surgical periodontal therapy with combination of laser can be the effective alternative treatment modality for periimplantitis. The next is dental hypersensitivity. How to use the laser. The study shows that with the lower power diode laser with 2 watts of power, exposing the 60 seconds and 2 millimeter away from the tissue. And if repeated treatment, if there is still sensitivity after 7 to 14 days after initial exposure. The result of the study shows that the laser affect the nerve ending to reduce hypersensitivity, and combination of sodium fluoride and diode laser made more comfortable and faster treatment. And also it has analgesic effects and change and block the nerve ending. Therefore, the laser therapy has provided extremely safe and effective result in the treatment of cervical dentin hypersensitivity. Lastly, treatment feature sealant. The laser irradiation of the hard dental tissue is modifying and reducing the susceptibility to acid attacks and caries. Laser treatment can promote the sterilization of feature because of this action on the dental plaque. The result of the study shows that a higher retention rate with the laser only and minimize the clinical time and lower incidence of caries and lower anxiety effects on patient satisfaction. Therefore, the laser preparation is safe, effective, and highly acceptable method of enamel preparation before sealant placement. These are our reference. Thanks for watching our video.